As COVID-19 or the coronavirus continues to spread across the world, it is important to take a few minutes to review information that will help to protect yourself, your family, and your community. Although much of this information is already available, we wish to ensure safety for both you and those around you. For those who do not have any symptoms, the primary goal is prevention. By taking these important steps, we will be reducing the chance of getting the virus ourselves and spreading it to others. The virus is very easily transmittable through bodily fluids. Therefore, it is important to take the following measures. We must protect our face, our hands, our environment, and our community. The virus can easily enter your body through the face. You should avoid unnecessarily touching your face, eyes, nose, or mouth with unclean hands. If you do have to touch your face, make sure your hands are clean and disinfected. If possible, use a tissue to touch your face and then immediately throw the tissue in the trash. Then thoroughly wash your hands with soap. Keeping your hands clean throughout the day is extremely important to minimize the risk of obtaining or spreading the virus. There are two effective ways to clean and disinfect your hands. The first is to use alcohol-based hand sanitizer that contains at least 60% alcohol. It is important to let the sanitizer dry completely before touching anything else, otherwise it will not be as effective. The second method is to wash your hands with soap and water, lathering the soap for at least 20 seconds. If you have to touch another person or are in a public area like a grocery store, office, subway, bus, etc., it is important to clean and disinfect your hands as soon as you return home. Again, remember, do not touch your face before washing your hands. The virus can survive on certain surfaces for up to 10 hours. The exact amount is still a matter of research. Therefore, it's important to keep your home, your workplace, your car, and other surroundings clean. This can be done by using a cleaner and a disinfectant. A cleaner like soap and water will remove dirt from surfaces. A disinfectant will help to remove germs, including COVID-19. Desktops, tables, counters, doorknobs, handles, and other high-traffic areas should be regularly cleaned and disinfected. Additionally, your phone can carry many germs and should be cleaned daily. Cleaner environments mean less chances of infection from the virus. When you have to interact with other people, it is important to keep at least 6 feet of space between each other to reduce the risk of transmitting the virus. So it's very important that we avoid unnecessary gatherings, as the virus can easily be transmitted when there are groups of people in a closed environment. Additionally, many state authorities have asked that large groups not gather for this very reason. Infection with COVID-19 can result in symptoms that resemble a cold or a flu. It's important to recognize these symptoms and know when to seek medical attention. Basic symptoms include a fever of 100.4 degrees Fahrenheit or higher, a cough, and body aches and pains. Be mindful of concerning symptoms that indicate that the disease may be worsening. These include a persistent or worsening fever that doesn't go away or any difficulty breathing. If you have any of the basic or concerning symptoms, there are certain steps that should be taken to protect yourself and your family. First and foremost, it's important that we do not panic. Most individuals recover quickly through routine care. You should first take steps to isolate yourself from your family by using a different bedroom and bathroom if possible. This is very important because we don't want to spread the disease to others in your family. You should call your doctor and notify him or her of these symptoms, and then follow his or her recommendations. You should also stay hydrated by drinking plenty of fluids. If someone at home is ill, the following steps should be taken to reduce the risk of transmission. The patient should be isolated from others with their own separate bedroom and bathroom. The patient's doctor should be notified immediately. When caring for the patient, you should always wear a mask and gloves. Surfaces touched by the patient should be cleaned and disinfected frequently. Monitor the patient for worsening symptoms, including a persistent or worsening fever or difficulty breathing. The caregiver should keep their hands and face clean using the methods prescribed previously. It is important to stay informed and updated about COVID-19 over the following days and weeks. For the most accurate and updated information, please visit www.cdc.gov. Also, please be careful about any messages you may receive through WhatsApp, Telegram, or email about this disease. If there is any doubt about the information you receive, please visit the CDC website for confirmation or call your doctor. Taking these preventive steps and following the guidelines mentioned in this presentation will help to minimize the risk of contracting this virus and transmitting it to others.